my content is talking about extra consent required for telemedicine, protecting and preparing your patient, some issues of software and systems, technological issues in general, and then protecting your practice. So whether you're a speech pathologist or an ear, nose and throat surgeon, there are some things that we need to consider that are out of the ordinary with telehealth. Some things work just the same, but there are some things that we need to consider separately. So in addition to the informed consent that we always get for procedures and processes, for understanding what's involved in a health encounter, we also need to get informed consent for telehealth. And so this should cover both the benefits and risks. The wording I have on this slide and the next slide come from the Royal College of General Practitioners, but each of the learned societies has their own wording. You need to think about whether we've got an understanding of what the benefits might be, seeing having a reduced waiting time to see the clinician, saving time to travel, and certainly the research we've done with telehealth in speech pathology services is patients are grateful for that time. Assisting the service to better look after them and reducing the risk of acquiring COVID or passing it on while addressing their voice concerns. So they need to know that they might not get all of these benefits. Likewise with the risks of telehealth, a video consultation, as both Dan and Kate have indicated, may not give you exactly the same service as you would with a face-to-face service. Patients and clients need to be aware that there could be some technical problems and they need to be patient. For older patients, it may be that they need to have someone who can assist them, even if that person is not physically present with them, but available on the phone as tech support. It may be that your receptionist or your practice manager will need to provide tech support while you're providing services. It is possible that we will have problems that are missed or misdiagnosed. It's a low incidence in speech pathology. The evidence suggests that we're equally accurate and equally specific and sensitive in our diagnosis and in our evaluations, but it is a possibility and we need to have patients acknowledge that. We also need to inform patients, if we're using a system that lacks appropriate security, that they understand that there's a risk that, as we say these days, new terminology, they may be Zoom bombed. There may be other people have access to that information. Of course, we have an obligation as health practitioners to prevent that, and I'm going to talk about some of the systems in a minute, but we do need to have our patients understand that consent. So this is in addition to our normal consent processes. So what can you do to protect your patient? Send them information about telehealth before the session so that they know what to expect and are prepared. In the case of pediatric clients, this may be information for the parents to share with the children, or it might be information in the form of child-friendly information that they can look at and understand what's going to happen. In the University of Sydney on-campus clinic, we have approximately 120 clients at the moment on telehealth, and those clients have a diversity of experiences. This is part of our problem, that there are people who are technologically digital natives, and then there are people like my mother who has difficulty with FaceTime. So you're going to have to work out how to prepare your patients, and that is beyond what they normally do. So that is, do they have a quiet space? Is it well lit and so they're not backlit? Are their devices and systems compatible? Many older patients will have old school phones. They may not have installed apps and so forth. And so we may need to have some way of helping them get to the level where you can provide good quality care. Ask them if they have a USB or some other plug-in microphone. That will help with sound quality. Check it before the session, if possible, perhaps with your receptionist or practice manager. If it's available for security purposes, enable the waiting room function and password functions. This will mean that you only take them in when you are ready to see them and they're not interrupting your previous client. Preset your session to have the video and audio off and change it when you begin their session. So these are things that protect the previous patient. And I've already said about the children. So that's ways we can protect the children if we're working in telehealth, protect the patient. Within the session, one of the things we need to do is we need to confirm their identity. Now, the ENTs are used to doing this because they don't want to operate on the wrong thing, but we need to confirm their identity, particularly if we haven't met them in person and so forth. We also need to then confirm their informed consent about telehealth and advise that you would like to record and obtain consent to record, which is again a third level of consent. So while we may obtain consent to record in the session, in the office, patients often don't realise that we will be automatically recording perhaps our Zoom or Skype sessions. Show them how to use the chat function and use that to share uncommon vocabulary. If you use the word larynx and they don't know what it is, you can write it for them in the chat function. So let me talk about systems briefly. There's a whole list. These slides will be available from the DVLP website. There's a whole lot of free systems listed there, and all except Doxy.me are not designed for health encounters. They can be used for health encounters, for video discussions, but remember, telehealth can be phone calls as well. So it may be that some of your patients will only be able to access you by telephone, and there is good evidence that in many areas of speech pathology practice, telehealth by telephone is effective. And in a number of areas of medicine, although I wasn't able to see whether ENT had that. So as you can see on the screen there, advantages: there's no cost to the patient or to you as a practice. They are often familiar to patients and clients, and they often have lower tech requirements. So they don't require very high bandwidth. So FaceTime is a low bandwidth interaction. Of course, the problem with low bandwidth may be low sound fidelity. The disadvantages, and the primary ones here for us as clinicians, is security and privacy. None of the free apps have high-level security, and very few of them can guarantee privacy. One of the issues here in the Australian Privacy Act, for example, requires that our records are held securely. The university interprets that as the digital records must be held in Australia. So if we look at FaceTime, the digital records are not held in Australia, and so that doesn't meet the university standard for privacy, and I suspect that if you sought legal advice, it may not meet your standards for privacy. This is where the consent becomes important, because it allows you to let your patient know that this might be a problem. Likewise, they have limited functions. So the chat function is there in most systems, but a whiteboard or an screen annotation tool is not necessarily available. And I can actually just show you a screen annotation tool, and here you can see I'm drawing on the screen with an easy screen annotation tool that's available in Zoom. Right, so they're the free systems. A very strong warning for everybody, of course. If it's free, then you and your patients are the product being sold to the advertisers. And of course, that is a significant issue when we're in a legislative framework that requires us to take account of our patients' privacy. Some of the free apps are time limited. So Zoom, you can only do 40 minutes and then it chucks you out. So do think about whether you want to pay for those systems. The paid systems include Skype for Business, paid Zoom, Microsoft Teams, and so forth. The ones in black on the screen are the office or general video conferencing systems, and then there are a number in purple there that are designed for medical encounters, and each of those has better security and is designed with waiting rooms and so forth. Zoom has a waiting room function, so you can have your patients in the waiting room, they can't see each other, and then as you roll through, you bring them in when you're ready to see them. So better security, no advertisements. However, the security is not perfect, the privacy is not perfect, and many of these are unfamiliar to patients and clinicians. I have to say that I started telehealth in Adobe Connect, and I found the transition to Zoom and Skype for business reasonably easy. Microsoft Teams has a lot of extra functions, and if you're not using Microsoft Teams in your business, I would suggest that you don't go there. DoxyMe looks very simple, and I don't have experience with Scopia, CoiView, or Pexip. So they are more complex to use, they may require more bandwidth, and that may cause a problem for patients in remote places, and also for patients who are not as wealthy. So how do you choose a telehealth technology? The first thing is it needs to work with the technologies in your practice. You need to understand what kind of encryption it has and where the data is stored. So this is, in Australia, we need Australian storage. In the US, this means it's going to need to be compliant with HIPAA, and each jurisdiction will have its own requirements, and we need to be compliant with those. Having an understanding of the bandwidth or the speed required for effective use is important. Most of the paid services require that they have 3 megabytes of upload or download per second for effective use. Without that, you have lag, buffering, and poor sound quality. And in this case, sound quality is a real issue. If you're trying to real-time assess someone's voice over the internet, then you need to have as little clipping and compression of the audio signal as possible. So find out from the system what's the processing speed, what's the upload and download speed, and then think about what storage capacity does each device at either end of the system need, and what system compatibility do they need. You know, many of our patients are operating on Windows 7, for example. Some of these platforms won't work on Windows 7. So taking that into account when you're choosing your telehealth technology, you want to be able to be accessible to the largest number of patients. You need to go with something that is more readily accessible, but maintains those privacy and security concerns. So some technological issues that we need to consider. The slowest link is the one that causes the delay. So it doesn't matter whether it's between your computer and your Wi-Fi, or it is some copper in the system. You've got to consider what the slowest link is. And if you are operating in a difficult setting where not many people have broadband internet, then you should be considering telephone services. Remember that poorer, more remote and older patients may have difficulties downloading and installing apps, having sufficient credit or data for video conferenced telehealth. Even our undergraduate students sometimes are on very limited data plans. Understanding a degraded signal, so if they have a concomitant hearing loss, then understanding a degraded signal because of the internet may make them unsuitable for telehealth, and they may have difficulty managing multiple channels simultaneously. So you've got the video input, the audio input, and you may then want them to be looking at something on the screen. Finally, in technological issues, sometimes, my sister sent me a video yesterday from a Mac phone to an Android phone. I can't view it. And it can be as simple as that. So some audio hints: ask the patient to put their phone on silent, minimize the background noise. Let's not have any typing noises like I'm doing now. Ask them to have a soft surface, you know, a tablecloth or a blanket on the table will help with better sound quality. Using an external or headset mic at both ends if possible. If you're using an external mic, then place the microphone on a flat, firm surface as close as possible and minimize the background noise. Close the door. Put the cats and the children on the other side of the door. Avoid turning away from microphones. It's very easy to reach for something and turn away, as I just did. And of course, what happens there is you may lose sound. And finally, people don't know how to talk to telehealth. They feel like you're a long way away, so they're going to over-articulate and over-phonate. So you may have to ask them to turn the volume up in their settings. You may have to walk them through settings in their Windows or Android or iOS system. All right, in terms of video, if you're looking at the screen now and looking at me, as I turn the lamp around, you can see that we get different video quality. So good lighting in your room, muted lighting on either side of your face is excellent, not only flattering for those of us with wrinkles, but also allows best vision of your mouth, and then no backlighting. Check the camera angle so that they're looking at the screen and that you're looking at the screen. Eye contact is important. Ask the patients to avoid wearing highly patterned bright clothing. Consider using phone audio and computer video. This will help with preventing buffering of sound, and patients should, if at all possible, use video for best effective communication. All right, we're getting to the end here. I'm sorry we're running over time. So what should you practice before? You, the clinician who's never done telehealth, you need to practice the systems that you've got: screen sharing, chat, using dual screens, playing video and audio, using an annotation or an online whiteboard as I did before. Those of us who use diagrams, we need to have our diagrams available electronically, and we need to know what they're going to look like. The diagram on the screen there, it's very hard to read the writing. If you use an anatomical model, how are you going to show it to your patients? One of the ways of doing this is to actually log in twice to the system, once with your laptop or your web camera and once with your phone. And then you can use your phone as a document projector or to look at a particular object. You can also get the patient to use their phone to look inside their mouth. So that can be a very helpful thing to do. If you insert your phone into your mouth like this, you get a very good view of the palate and the tonsils. Try using a professional virtual background. Now, I'm just going to show you how that looks. I've just downloaded a professional background, and I'm going to change from being in my study to being in an office. And for some people, this will give increased credibility, particularly if you're working at home and your background is not one that is conducive to trust and so forth. You may want to have a virtual background. That would be helpful. Okay, check your own sound. Oops, sorry. Check your own sound and consider how you will switch from Wi-Fi to a phone hotspot if required, and give your patient instructions on doing this if you think it's going to be required. If you're going to make handouts for your patients, do that for all of them. So practice doing that. The general advice is if you can plug in using an Ethernet cable to your router and sit as close as possible to your router rather than relying on the Wi-Fi per se, that will reduce buffering and lag. Right, so last points from me. How do you protect your practice? Making sure that you've got suitable software and security, obtaining consent, considering your online identity. So what is your sign-in name? I would suggest that you use your professional name, that you don't use nicknames or shortcuts. And if you're going to put up a photo, put up a professional photo. Do not use an avatar. Make sure that where possible you use passwords. You provide people with specific logins for them that don't that are not for anyone else, and you use waiting rooms. If at all possible, use a virtual private network. That helps keep your data safe. Keep the records, even if it's an auditory consent to telehealth and recording, keep that record, and do consider the legal requirements in your state and country for privacy, copyright, and various telecommunications acts if you're going to record people. And in that respect, I would seek legal advice. So troubleshooting, start off, we joined this webinar half an hour beforehand so we could all check our slides. Do the preparation of contingency plans for technical problems during a video consultation. What will happen if it doesn't work? I will call you. Understand, have a plan, have the plan sent to your patient before the session. Make sure they understand what's going to happen if it goes wrong. Have troubleshooting guidelines for the particular technical problems and send them to the patients. And if at all possible, have a dedicated person in the practice who can provide technical support on the spot to your patient while you continue the clinical work. And that is a very brief tour of some of the issues that we need to consider in speech pathology and ENT telehealth transition.